Hey Dan, we are seeing just a plethora, it's one of my favorite words, of
That's all right.
research and discussion around AI and the therapy space, right? This is coming from places of state legislation and even just in research. What are we doing with AI in the mental health space? There's an article here that we're going to talk about, and we can link it in the show notes, but tell us a little bit about the article you found.
I have been really deeply troubled by, and I think that what's really important here is we call it AI, but really what we're talking about is a computer algorithm generating responses. There is not intelligence underneath this. And there are computer algorithms that generate responses based on what those algorithms have been programmed to respond with. And the biggest issue we're seeing with this in the therapy space is that people are utilizing these computer generated algorithms to produce something that mimics psychotherapy. And the reason this article is so fascinating, and it's not directly related to what so-called AI therapy at all, it's really about how many mistakes are made by AIs. And what they found is when you ask AI, these large language models is better, probably a better way of saying it, these large language models about psychological research, about 1 in 5 of the research articles that they cite are non-existent. They're not even they're completely made up out of whole cloth. They're not even misinterpretations of articles or incorrectly cited articles. They are just articles that do not actually exist that they have
And
created.
And we know that these large language models so-called hallucinate, right? They make up data. But boy, this is going to be a really hard piece of data to ferret out and find that it's been made up and correct. Like I think they're
Yeah.
doing a better job of like correcting some of the hallucinations, but boy, this is going to be a tough one to recognize as a hallucination.
Sure. And even where they're when they're not made up out of whole cloth, and the 80% of the time that they're actually research articles, about two-thirds of the time they read them wrong or they misinterpret things or they don't.
Mhm.
So you take these large language models, these computer algorithms, and then people start talking to them as if it's a therapist and getting responses that sound like therapist responses, but may be wildly inaccurate, really incorrect, or have some sort of bias. One of the things you may have noticed if you ask some of these so-called AIs questions, they will often sort of lean into what you've said and like agree with you. That may be a terrible thing in psychotherapy. It may get you using their system more, in psychotherapy isn't likely to be beneficial.
Well,
And
unfortunately, I mean, we've seen some really tragic cases where your point exactly, where it's leaned in and has provided really dangerous guidance.
right. So I'm looking forward to states passing laws that are going to really tighten up on the use of AI or so-called AI in psychotherapy. Um, is I want to say it's Illinois
It is,
has
yeah.
okay. Illinois has banned it entirely, and I think we're going to see a lot of state legislatures taking up some legislation over this to really try to protect people
Yeah.
from some of the problems that we're seeing here. And I think this research article that we've linked really speaks to how often these things get it wrong. If you were using voice dictation that got things wrong, made things up 20% of the time, if you were using a car that drove itself and it did something wrong 1 out of every 5 decisions, like that's insanely unhelpful. And imagine a therapy algorithm that got things made things up 20% of the time. That's going to really potentially screw people up. So
Yeah.
I'm very worried about this.
And I think I've been glad this week to hear our own local professional organization taking this on and creating some advocacy here in Minnesota. I'm hoping that it's looking a little bit more like what they've done in Illinois. And then, I wanted to piggyback on, on that decision-making model. I think it's tempting to think as a therapist, oh, I'll just find where the incorrect information is and I'll be able to sort it out because I'm a therapist and I'm trained. But what we're really saying is the underpinnings, the foundational research that you may be trying to make clinical decisions on, it could be flawed 20% of the time, and that's problematic. And the reality is, most of us therapists are not looking up questions about depression and anxiety, we probably have that really well nailed. We may be
Mm,
looking at things that are a little bit outside of our scope of competency or something that we're interested in developing. And that's where the numbers go down from there. So if we say 1 in 5 have errors, you start looking up something that's a little just but adjacent to your scope of competency. So
mm.
you want to research it and you think, oh, I found it, and here's the data to back it up, and the articles look good. All of a sudden, you're working on even worse data, even
Right,
more
right.
flawed information, and so that's problematic. And so this is not just a warning for consumers, the lay public turning to large language models to absorb this information and utilize it, but also to therapists. We'd like to think we know better, and
Hmm.
we can be just as easily duped.
Right. The bottom line is large language models not ready to be therapists. And if you're a therapist or you're a person looking for information about mental health and you're utilizing one of these so-called AIs to that, double check those research articles before you rely on them because they may be inaccurate or inaccurately interpreted or they may not exist at all.